Alright, well, welcome all. My name is Steve Dillenbeck. The purpose of my speech today is to guide you in the direction of obtaining a 12-lead EKG. It's to instruct you, the student, of the correct placement of EKG leads and the operation of the Zoll heart monitor to obtain a 12-lead EKG. Basically, some reasons why we would want to obtain a 12-lead EKG. According to the American Heart Association, the 12-lead EKG stands at the center for decision-making when dealing with a patient experiencing an acute coronary syndrome. It should be a part of your routine assessment when dealing with these types of patients, and it's critical in the diagnosis and treatment and determination of your treatment in the cardiac patient. So basically, the first step to obtaining the EKG is to go ahead and explain the procedure to the patient. Let them know that it can be somewhat invasive. Generally, we need to get their shirt off or at least pulled up so that we can put the electrodes on the patient's chest. You want to reassure the patient of the procedure. Today we've removed Max's shirt so that we could perform the procedure. Generally, it should be done. It should be taken when the patient's in the laying position on their back. So I have already turned my heart monitor on. This is the Zoll 12-lead heart monitor, or Zoll CCT monitor. I've hooked up all my electrodes to my electrode cables. And we're going to start with the arm leads. Basically, they're all labeled. So the first one we want to start with is the left arm. These need to be placed actually out on the patient's limbs, or arms and legs. The next one we're going to do is the right arm. I got them all tangled. Perfect. Thanks, patient.
You're welcome. Will you hold those?
The next one we're going to do is the left leg. We'll stick that one on his belly there. And the right leg. With these 4 leads, the heart monitor is actually going to start picking up a rhythm. But we're not done yet. We have to hook up the next 6 leads. So the first one we're going to do is V1. What you want to do is find the clavicle on the patient. That's going to be your first intercostal space just below that clavicle. From there you want to go down to the 4th intercostal space. So we'll find the right clavicle, we'll come over to the sternum, and we'll count 4 intercostal spaces down. That's where we'll put V1, just to the right of the sternal border. V2 we're going to place directly across from V1 on the left-hand side of the sternal border. We're going to skip V3 for now and go straight to V4. V4 is going to be your 5th intercostal space, mid-clavicular line. We're then going to go back to V3. V3 is going to go directly in between V2 and V4. We're going to skip V5 for now. We're going to go straight to V6. V6 is going to be the mid-axillary line, 5th intercostal space. And then V5 is going to go directly between V4 and V6. So as you can see, we've got all our leads hooked up at this point with the electrodes placed. At this point, we'll go back to our monitor here. There's a little button here that says 12 lead. It's a soft key that we're going to hit. It brings up some more options. On the left here is acquire. You're going to hit acquire, and it's automatically going to take the EKG. Once it takes the EKG, it's going to print you a copy of that so that you can look at it and start basing your treatment off of what you see on your EKG. A couple things to remember: you want to make sure the patient stays completely still while you're taking or acquiring the 12-lead EKG. So as you can see here, our 12-lead is printed out. At this point, we could go ahead and interpret that 12-lead and base our treatment modalities off of what we see on that 12-lead EKG. So in conclusion, hopefully you all are comfortable now with the placement of electrodes to obtain a 12-lead EKG. And I hope you found this speech both informative and educational. Thanks.